Roughly 80% of seniors taking B12 for peripheral neuropathy are taking the wrong molecular form, one their aging nervous system cannot efficiently convert into what nerve tissue actually needs to repair itself. The burning in your feet tonight may be the direct result. The supplement in your medicine cabinet right now may be the specific one that needs replacing. Here is what nobody at the pharmacy counter tells you. Standard drugstore B12 must be converted into methylcobalamin before it can reach nerve tissue. And in adults over 60, that conversion becomes significantly less efficient. So if you have been taking your B12 faithfully every night and still waking up at 2 a.m. with feet on fire, you were never told the part that actually matters. My name is Dr. James. For over 25 years, I have specialized in peripheral neuropathy and nerve damage in adults over 60. In the next few minutes, I will walk you through 5 specific supplement corrections that research suggests may meaningfully support nerve repair and neuropathy symptom management. Changes you could discuss with your doctor as early as tomorrow morning. This is your nerve health right now, and what you do next may determine whether the next 6 months look different from the last 6. The majority of seniors who walk into a neurology clinic with worsening peripheral neuropathy are already taking B12, not occasionally. Daily, for months, sometimes years. The discipline is there, the consistency is there, and the burning in their feet has not changed at all. That is not a coincidence. That is an information failure, and it has been happening quietly for a very long time. Here is the biological reality behind that failure. Your nerves are wrapped in a protective coating called the myelin sheath. Think of the rubber insulation around old household wiring. When that insulation degrades, the electrical signal traveling through the wire misfires, weakens, and eventually stops arriving where it needs to go. That is what peripheral neuropathy feels like from the inside. The wire is still there, the signal is still trying, but the casing is damaged, and your body needs a very specific material to begin repairing it. That material is active B12, methylcobalamin, and the form in most standard supplements is not it. The form found in the majority of drugstore B12 supplements is called cyanocobalamin. Before your body can use cyanocobalamin for nerve repair, it must convert it through a 2-step enzymatic process into methylcobalamin, the neurologically active form that peripheral nerve tissue can actually use. Research suggests that conversion process becomes substantially less efficient in adults over 60, meaning a significant portion of the cyanocobalamin you have been faithfully swallowing may be metabolized before it ever reaches the nerve tissue that needs it. If you have been supplementing for nerve health for a year or more and your symptoms have not shifted, the active compound may simply never have arrived where it was needed. The 5 corrections I'm about to walk you through are documented in clinical and nutritional neurology literature. Almost none of them make it into a standard pharmacy consultation. What you are about to hear is the specific layer of neuropathy supplement knowledge that most people never receive, and it starts with the correction that changes everything else. The single most important variable in B12 supplementation for peripheral neuropathy is not the dose. 2 patients can arrive at my clinic with identical diagnoses, identical lab work, identical years of symptoms, one taking cyanocobalamin daily, one taking methylcobalamin daily. The difference in their symptom trajectory over 6 months is not subtle. The only variable is one word on a label. Methylcobalamin is the neurologically active form of B12. It does not require conversion. Research suggests it crosses into peripheral nerve tissue more efficiently in aging bodies, where it may support the maintenance and gradual rebuilding of the myelin sheath and contribute to axonal regeneration, the slow process by which damaged nerve fibers attempt to repair themselves. Cyanocobalamin cannot replicate this in seniors whose conversion pathway has already become inefficient. Directional findings published in the Journal of Neurological Science on methylcobalamin and peripheral nerve conduction in older adults consistently point toward the active form as meaningfully more relevant for neuropathy management, though this research is observational and ongoing. Before changing your B12 supplement, the form appropriate for your specific health situation, including delivery method, whether sublingual absorption may be more effective for you than a standard tablet, and whether injectable B12 is worth discussing, is a conversation to have with your doctor first, not a decision to make at the pharmacy counter alone. Methylcobalamin alone, however, is rarely the complete answer. The compound that research suggests dramatically amplifies its effect on nerve tissue is almost never mentioned alongside it. And addressing only one without the other may be why so many seniors who do switch to the active B12 form still find their progress slower than expected. Nerve damage does not live in isolation. It lives in an environment, and that environment, in most seniors with peripheral neuropathy, is one of chronic oxidative stress. Alpha-lipoic acid is a unique antioxidant, both fat and water-soluble, which means it can penetrate cell membranes that most antioxidants cannot reach. Research suggests it may reduce oxidative stress specifically within peripheral nerve tissue, potentially slowing the progression of myelin damage and supporting nerve conduction velocity. It has been studied more extensively in the context of diabetic peripheral neuropathy than almost any other nutritional compound. European clinical trials examining alpha-lipoic acid and nerve conduction outcomes over 24-week supplementation periods have produced directional findings that neuropathy researchers continue to reference, though all results require qualification and individual response varies. Before you add alpha-lipoic acid, understand that this particular supplement can interact with blood sugar medications and thyroid medications in ways that matter clinically. This is not a general wellness caution. This requires a specific conversation with your doctor before you add it, regardless of how it is marketed at your pharmacy. Before we continue, drop a comment right now and tell me which supplements you are currently taking for your neuropathy and how long you have been on them. Not a simple yes or no. I want to hear your actual experience, because the pattern of what seniors have been told to take and how long they have been taking it without result is something I want to understand directly from the people watching this. The next correction targets the specific nerve pathway that governs sensation in the feet, and it is one that most seniors with burning neuropathy have genuinely never heard addressed by name. The B vitamin most people associate with nerve health is B12. The one that may be quietly failing your peripheral nerves without anyone mentioning it is B1, specifically the form of B1 your body can actually absorb into nerve tissue. Standard thiamine, the form in most multivitamins and B-complex supplements, is water-soluble. It does not cross cell membranes efficiently. It circulates, it metabolizes, and in meaningful amounts it never reaches the peripheral nerve fibers where it is needed most. Benfotiamine is the fat-soluble form of B1. Because it is fat-soluble, it crosses cell membranes in a way standard thiamine structurally cannot. Research suggests benfotiamine may support what is called the transketolase pathway inside nerve cells, a metabolic process that, when functioning properly, reduces the accumulation of advanced glycation end products, which are metabolic byproducts that research indicates contribute significantly to nerve fiber damage in older adults with and without diabetes. The mechanism here is not a higher dose of the same molecule. It is a fundamentally different molecule with a different ability to reach the tissue that matters. Directional findings from the European Journal of Nutrition and neuropathy-specific clinical literature on benfotiamine and sensory nerve symptom reduction support this distinction, though as with all nutritional research, results are qualified and individual. Harold was 68 when he first came to the clinic. For 2.5 years he had been waking between 1 and 3 in the morning with burning in both feet severe enough that he kept a cold towel on the nightstand. He had been taking a B complex and a standard B12 supplement every single evening without fail. His lab work showed B12 levels that appeared technically within normal range because cyanocobalamin had been accumulating in his blood without converting efficiently into the neurologically active form his nerves actually needed. Under his physician's guidance, Harold switched to methylcobalamin, added benfotiamine, and introduced alpha-lipoic acid. Within 6 weeks, he reported measurable reduction in nighttime burning. He still manages his neuropathy, but he sleeps through the night now. Harold was not failing at his health. Harold had been given half the information. If Harold's story feels uncomfortably close to your own, the discipline, the waiting, the mornings that never changed, you may have been one specific label check away from a meaningful correction for longer than you realized. The question from the beginning of this video, which form of B12 actually reaches nerve tissue, is answered here. It is methylcobalamin. It is not the form in most standard supplements. It is available at most pharmacies. Your nerve health right now may hinge on a single word printed on the back of a bottle you already own. I want to stop here for a moment, because the fourth correction is one I think about differently than the others. Early in my practice, I had a patient, a retired school teacher, genuinely meticulous about her health, who had worked her way through every supplement her previous doctor had suggested and stopped all of them because nothing had helped. She had given up on the category entirely. What nobody had ever checked was her magnesium level. She had been on a diuretic for years. Her magnesium was severely depleted. 2 months after we corrected that single deficiency, she told me the constant buzzing in her feet had quieted for the first time in years. I think about her every time I see a neuropathy patient who says they have tried everything. Sometimes trying everything means you were never given the right list. Magnesium is the mineral most commonly depleted in seniors taking medications including metformin, certain blood pressure drugs, and long-term diuretics, and its deficiency most directly disrupts the nerve signal transmission that peripheral neuropathy already compromises. Magnesium plays a regulatory role in how nerve signals travel, and research suggests it may help modulate the hyperexcitability of damaged nerve fibers, that persistent firing that produces burning and tingling sensations even when nothing is physically touching the skin. The form matters here too. Magnesium glycinate is absorbed more completely than magnesium oxide, the form found in most low-cost supplements. Population-level neurological and metabolic research on magnesium depletion and peripheral nerve function in older adults on multiple medications points consistently in the same direction. Deficiency worsens nerve signal quality, and correction may support it. Magnesium supplementation can interact with certain heart and kidney medications in ways that are clinically significant. Before adding any form of magnesium, review your current medication list with your doctor specifically, not as a general precaution, but as a necessary clinical step. The fifth correction is the one most commonly dismissed because it does not arrive in a capsule labeled for nerve health. But without it, everything else on this list is attempting construction without adequate raw materials. Nerve cell membranes are not static structures. They require constant renewal, and the primary fatty acid that determines whether those membranes remain fluid and conductive is DHA, the omega-3 fatty acid found in fish oil. Without sufficient DHA, nerve cell membranes become rigid, conduction slows, and the inflammatory signaling that amplifies neuropathy, pain perception intensifies. Research from neurology and clinical nutrition on omega-3 supplementation and neuropathic pain modulation in older adults suggests that DHA-rich omega-3 supplementation may support nerve membrane integrity and reduce the inflammatory component of neuropathy symptoms, not as a structural repair agent in isolation, but as the foundation that makes structural repair biologically possible. This research is directional and qualified, but the mechanism is well established in neurological science. If you are currently taking blood thinners or anticoagulant medications, omega-3 supplementation at meaningful levels requires a direct conversation with your doctor before you begin. It can affect bleeding time in ways that interact with those medications specifically. Knowing these 5 corrections is the beginning. Understanding what to do with them tonight is what separates information from actual change for your nerve health right now. Something shifted in this video, and it is worth naming directly. You came in carrying the specific exhaustion of someone who has done everything they were told, bought the supplements, maintained the routine, waited for the burning to ease, and watched nothing change. That exhaustion is not irrational. It is the logical result of following advice that was missing its most critical detail. When patients tell me they have already tried B12, already tried magnesium, already tried fish oil, and felt nothing move, my first question is never whether they tried hard enough. It is always, which form, and were they combined in a way that the research actually supports? Nerve repair is not like bringing down a fever. It does not respond to effort alone. It requires the active form of the nutrient physically arriving at the nerve tissue in an environment where it can be used. Cyanocobalamin circulating in your bloodstream while your peripheral nerves continue to deteriorate is not a failure of will. It is a mismatch between what you were given and what your nervous system actually needs. The inputs were the problem, not you. And the specific correction, the one that begins tonight with a label check that costs nothing, is exactly what comes next. What you are holding right now is something most people who visit a pharmacy for neuropathy supplements never walk out with. The specific knowledge of which forms, which combinations, and which biological reasons make the difference between supplementing and actually supporting nerve repair. That knowledge only becomes useful when it moves into action. The first thing to do is tonight, before you go to sleep, go to your medicine cabinet and find your current B12 supplement. Turn it over and look at the ingredients. Find the form of B12 listed. It will say either cyanocobalamin or methylcobalamin. If it says cyanocobalamin, you now know precisely what that means for your nerve health and what a single label change may represent. This check costs nothing and takes 30 seconds. The second thing to do is tomorrow. Write down 3 names: methylcobalamin, alpha-lipoic acid, and benfodiamine. Take that list to your local pharmacy and ask whether these forms are carried. Then take the same list to your doctor and have a specific conversation about whether these forms and combinations are appropriate for your health situation, your medications, and your current symptom profile. Do not change your supplement regimen without that conversation. The interactions discussed in this video are real and require clinical oversight. The third thing to do is over the next 4 weeks. Choose one symptom, burning, tingling, or numbness, and track it with simple daily notes. Not a score out of 10. Just a sentence. Nerve repair moves slowly, and expecting dramatic change in days sets up discouragement that stops people from continuing what may be genuinely working. 4 weeks of consistent notes gives you and your doctor actual data to evaluate together. Checking that label tonight changes nothing immediately and costs nothing at all. It may also turn out to be the single most useful thing you do for your nerve health this year. Research suggests that peripheral nerves in older adults retain some measurable capacity for repair and adaptation, and that correcting specific nutritional deficiencies may help slow symptom progression and support daily nerve function in ways that matter in real life. Not a reversal, not a guarantee, an honest, evidenced reason to take the next step. Everything covered in this video comes down to 5 specific corrections that research suggests may meaningfully support nerve repair and neuropathy symptom management in seniors. Methylcobalamin, the neurologically active form of B12 that does not require the conversion aging bodies struggle to complete, and that research suggests reaches peripheral nerve tissue more efficiently than cyanocobalamin. Alpha-lipoic acid, the fat and water-soluble antioxidant that may reduce the oxidative stress in nerve tissue where myelin damage progresses. Benfodiamine, the fat-soluble form of B1 that may cross nerve cell membranes where standard thiamine cannot, and that research suggests may reduce the metabolic byproducts that contribute to nerve fiber damage. Magnesium glycinate, the bioavailable form of magnesium most commonly depleted by medications seniors frequently take, and that may support the nerve signal regulation that peripheral neuropathy disrupts. And omega-3 fatty acids rich in DHA, the structural raw material nerve cell membranes, required to remain conductive and to reduce the inflammatory signaling that amplifies pain perception. Tell me in the comments which form of B12 is listed on your current supplement label, and whether after watching this you plan to bring the form difference up with your doctor at your next appointment. Not a simple yes or no. I want to hear your actual situation because your nerve health right now is specific to you, and what people share in the comments here genuinely informs what this channel covers next. If someone in your life has been told to take B12 for nerve pain and has been taking it faithfully without any improvement, they deserve to know that the form on the label is not a minor detail. One conversation, one forwarded video, one label check tonight. That is a real and specific thing one person can do for another. In the next video on this channel, the 3 foods that research suggests may actively accelerate nerve fiber damage after 60, and why 2 of them appear regularly on standard heart-healthy diet lists. Living with peripheral neuropathy while unknowingly taking a supplement form your body cannot efficiently use for nerve repair is one of the most correctable situations in senior health, and one of the least discussed. The frustration you have been carrying was earned honestly. The correction is now in your hands.